Hello, my name is Rosalind Person, and we are going to be talking about informatics and nursing sensitive quality indicators. We will begin this presentation with defining National Database of Nursing Quality Indicators, NDNQI, which is a database where nursing quality is measured. This database provides organizations with report at state, national, and regional levels with distribution of percentages of quality measurements. NDNQI uses indicators to assess nursing care. Three indicators are primarily used in creating this database. Structure. Structure explains the nursing community providing care, such as the quantity of staff, as well as the skill level of the staff and educational level. The process assesses the same nurses, assessment of care, intervention used in care, and how satisfied they are with the care that they give. Finally, the outcome. An outcome referring to the patient safety as a result of the processes and interventions that were used. It is important for nurses to understand how important of an impact they have on quality of care that patients receive, as they are often on the front line and spend more time with the patient than any other healthcare professional. This information provided by NDNQI helps in quality improvement for nursing protocols with proven working strategies designed from evidence-based practical informatics. Quality indicators that we are going to address today, the specific one is pediatric pain assessment, intervention, and reassessment. The cycle of that. A lot of times that is undervalued and underprocessed or not done consistently. Pain assessment is considered the fifth vital sign and should be a part of every assessment and reassessment. We as nurses have to realize that pain is what the patient says it is, not what the family feels or what we feel. In pediatrics, it is even more important to assess the signs and symptoms and nonverbal cues that the patient presents with. Signs and symptoms are very important at different age levels. They can be crying, elevated vital signs, or grimacing, just to name a few. Pain assessment that was reported in a recent satisfactory survey determined that regardless of the setting, pain is not as well managed as it should be. It is important for nurses to address their own bias concerning pain management before addressing patient outcomes in this area. Based on NDNQI, it was determined that the percentage of nurses that have a better understanding of pain management have more experience and higher certification, which is unfortunate and needs to be improved. This assessment findings are a major indicator that as nursing teams, we must continue to do nursing education on pain management from the beginning, not when they have had more experience. Addressing the fifth vital sign and the quality indicators of nursing care associated address the overall quality of care for the patient. Not addressing pain interferes with improvement of care and makes other interventions difficult to assess. If pediatric patients are in pain, they will be less cooperative and less trusting with other procedures such as x-rays and lab work. If we are unable to address the pain, then it makes intervention more difficult, and it needs to be addressed just as important as we address airway, breathing, and circulation. It is a part of our duties as nurses to assess and reassess our patients in all aspects of care. In order for me to gain more awareness in this area, I touched base with a coworker on the Safety and Quality Control Committee. We discussed several aspects, And these are some of the results that were discussed. Working with the committee, she was able to gather information on personal observations from other sites, as well as her own, on what they did to improve pain assessment and reassessment. After collecting data from interdisciplinary team members at other sites, she did research in evidence-based practice areas that supported her findings. This reduced staff from taking these teaching moments personal and accepting them more as areas of improvement that were shared with other staff members in various sites as well. Data collection was also done in patient surveys to determine if the patient's pain, if any, was managed. Follow-up data was done in patient charts of these specific patients where pain assessment was reported to not be managed to see what documentation was done upon assessment of pain, providing pain intervention, and reassessment follow-up. These results also helped in nursing education on how to manage real concerns of pain versus disseminated, aggregated data to produce high-quality results to improve patient-centered nursing care. Because sometimes it was reported that the patient had pain and it was not addressed when there was no data to support that. Because maybe it was reported by a family member and not necessarily the patient. But all reported pain should be assessed and addressed to determine the best possible outcome for the patient. In collecting data on these findings, then I was able to better get an understanding of the importance of pain management at every level of nursing, whether it be pediatrics on up to older adults. So what we have to understand and what is very important is that as nurses, we have to give the best quality of care. And in doing so, we have to assess our patient and reassess our patient and do as many interventions as possible to give the best possible care. It is also just as important to document every aspect of care. We have to make sure that we are documenting that we assessed their pain level and documented our subjective and objective findings. And then what intervention, if any, was provided. And then we need to document our follow-up because that is a part of nursing care. Nursing is collecting data, assessing that data, making an observation, making a plan of care, and implementing the plan of care. And then reassessing to determine what interventions were done. Were they effective? Do we need to seek other interventions to improve the quality of care that we provide? And that is why this particular level of quality indicators is so sensitive and important when it comes to giving quality nursing care. And our patients and patient-centered care needs to be first and foremost. And assessing every aspect of them and putting them first and putting aside our own bias is first and foremost. Thank you.